University of Virginia Health System, we're for sharing the latest health information from top minds to keep you and your family healthy. With UVA Health System Radio, here's Melanie Cole.
It's most commonly linked with pitchers, but athletes aren't the group of people most likely to suffer rotator cuff injuries. My guest today is Dr. Winston Gwathmey. He's a board-certified orthopedic surgeon whose specialties include sports-related injuries to hip, shoulder, knee, foot, and ankle at the University of Virginia Health System. Welcome to the show, Dr. Gwathmey. So tell the listeners, what is the rotator cuff, and what does it do?
Thanks, Melanie. The shoulder is a very complex joint that has the highest range of motion of any of the joints of the body, and so intrinsically there's very little bony stability. The ball and socket of the shoulder joint isn't really held together by much in the way of bones and ligaments. So the rotator cuff is a complex group of muscles that sort of wrap around the ball and socket and sort of hold the ball positioned within the socket so that you can have that entire arc of motion without having any compromise of the mechanics of the ball and socket joint.
So this is a very movable joint and also more complicated to treat if it's injured, but easily injured. So we hear a lot about rotator cuff injuries. How do they occur, and what exactly is a rotator cuff tear? We hear so much about that, Dr. Gwathmey.
Yes, ma'am. There's actually a continuum of injuries. The rotator cuff is actually a pretty robust structure within the body. But as we sort of get older, a lot of things start breaking down the body, and the rotator cuff in particular goes and undergoes a lot of miles over the course of your lifetime. And so, as people enter their 40s and 50s and 60s, just that motion that's been going on there for so long can cause some breakdown. What ends up happening with the rotator cuff is it's a continuum, and starts with some tendinitis or some impingement type symptoms in the top of your shoulder, which is basically sort of just shoulder pain. And as that tendon starts to become attenuated, it's more prone to tearing. And sometimes it might be something as little as just overuse, or sometimes it requires a more dramatic injury like a fall or something like that for that rotator cuff structure to be injured. But it can be quite debilitating when it does occur.
Well, tell us some of the symptoms, because I know that when people say, oh, it hurts to roll over on my side at night or put a jacket on, and tell people what they might, experience that would send them to see you to look and see if it's some rotator cuff problem.
Of course. I think most people, as they get older, they have shoulder pain. They assume it's their rotator cuff, just because that's sort of the most, it's sort of on the tips of everybody's, tongue whenever they're thinking about shoulder pain. The most common symptoms for rotator cuff pathology is typically pain sort of in the top or the front of the shoulder, worse with overhead activity like lifting like a milk jug into the top of the refrigerator or something like that, or trying to put your clothes on. A lot of times it's pain at night, and as the disease process progresses, sometimes it can also be associated with weakness in those same the same positions, the same movement. So normally you could easily put the milk jug in the top of the refrigerator, and as the rotator cuff becomes more pathologic, it's more difficult to do that, and you have pain as you try to lift your arm above the level of your shoulder.
So if you're diagnosed with having some sort of a rotator cuff injury, what treatments are available? And speak about non-surgical treatments first, and then if it becomes bad enough, they have to deal with surgery.
I think the algorithm is no question that the first approach to a rotator cuff injury is going to be non-operative treatment. For the most part, there's a lot of redundancy around the shoulder as far as function, and even full-thickness rotator cuff tears can be treated non-operatively initially. There's actually been studies showing that in the average active population, almost a quarter of people over the age of 60 and almost half of people over the age of 80 actually have full-thickness rotator cuff tears and may not even know it. So the goal of the initial goal of treatment is going to be trying to make that tear asymptomatic, which is certainly possible with a good treatment algorithm. Normally, it requires some degree of either physical therapy, exercises, or activity modification to sort of try to get the other muscles around the shoulder to activate and to fire, so that you can accommodate for the fact that one of the muscles up there has an injury. So for the most part, if the patient comes to sees me with sort of rotator cuff type pain, we try to sort of get an idea of the degree of pathology, and then normally, even if someone does end up having surgery, therapy or some sort of exercises are always helpful to sort of optimize the mechanics around the shoulder before we even get started with anything else.
What about cortisone shots? I know people, Dr. Gwathmey, that have had 5, 6, 7 of them. How many can you get, and does a rotator cuff ever, if it's a tear, does it ever really truly go away on its own, or that really just doesn't happen?
Well, most of the natural history studies of rotator cuff pathology show that once a rotator cuff is torn, it will never actually heal. In fact, most of the time it has some degree of progression. The speed of that progression is really what defines what the treatment is going to end up being. Cortisone, I think, is very helpful for a couple of reasons. One, I think in some of these acute inflammatory situations, it can actually take a tendon that's sort of inflamed and swollen and causing more pinching up above the shoulder. I use the analogy of a fat lip. When you have an injury or something like that to your lip, you sort of keep biting it over and over again until the swelling goes away. And sometimes with the rotator cuff, when you're trying to get your arm above your head, the fact you're sort of pinching that swollen tendon can sort of propagate the symptoms and sort of perpetuate the symptoms. And so I do use cortisone periodically for people to try to see if I can't get that inflammation out of the shoulder to get them a more pain-free range of motion so that they may make more progress with therapy and so that perhaps they can render this tear asymptomatic, which ultimately is the goal for all of this. And to be honest, these things, the tendon's not going to heal back down to the bone, but in a lot of cases, we can actually make patients asymptomatic, and I think that's the goal is to get them back to what they want to do.
When does surgery come into play?
I think when people have failed all those conservative treatment strategies, if they've done therapy, they've done a cortisone shot or two, they've even taken anti-inflammatories, and really they're not able to do what they want to do. Pain at night, pain with routine activities, weakness, so they can't get their arm over their head. And that's really when we start talking about surgery for this. And I always tell my patients it's not a very fun experience to go through rotator cuff surgery. You end up in a sling for 6 weeks. You have to rehab pretty extensively for 3 to 4 months, and so that's why we try to get people better without surgery. But if they do go to surgery, it's fairly straightforward. We just take the tendon that's torn and we repair it back down to the bone where it had ripped from. And once that process occurs, and once the healing occurs, typically the symptoms get much better after surgery.
So speak about prevention of rotator cuff. So you mentioned that as we age, many people have rotator cuff injuries that they may not even be aware of. But what about prevention and keeping that good, strong shoulder?
Of course. Prevention is the key to everything when it comes to, as we get older, our bodies are going to have some degree of mileage that's going to be put upon them. And the goal of I guess, aging effectively is to try to stay optimized, stay healthy, exercise, those kinds of things. Within the shoulder in particular, it's always good to keep all the muscles around the shoulder fairly active and fairly strong, so that you can accommodate, or you can tolerate this sort of wear and tear kind of stuff. A lot of people who are very sort of just fit people, they have a rotator cuff tear, they may or may not even know because they have so much extra muscle around the shoulder that sort of can help out. But it's hard to prevent things that sort of happen naturally with aging, and so I guess just trying to figure out how to live with the symptoms and how to improve the symptoms through exercise is probably the best thing.
And Dr. Gwathmey, in just the last minute or two, why should patients come to UVA Orthopedics when they suffer a rotator cuff injury?
Well, we treat the entire spectrum of shoulder pathology, and a lot of people come in with their primary care doc says they have a rotator cuff problem, but really we're pretty comfortable treating the entire spectrum of injury, and so sometimes it's not just a rotator cuff. There could be an element of biceps or labral pathology as well. There could be an element of arthritis as well. And so what we can do here, I have 4 partners and myself, all of whom treat shoulder injuries, is we can take them through the entire natural history of their shoulder and provide basically care across all spectrums of shoulder injury, from shoulder instability, meaning shoulders that would like to dislocate or shoulders that have arthritis, or shoulders that shoulders that just need just some direction as far as why it hurts and how to make it feel better. And also we have the 5 of us, all of us do arthroscopic surgery for the shoulder to repair these things, so it's minimally invasive, and we get people back to their activities as quickly as possible.
Thank you so much. And for more information on UVA Orthopedics, you can go to uvahealth.com. That's uvahealth.com. You're listening to UVA Health Systems Radio. This is Melanie Cole. Thanks so much for listening, and have a great day.